Well, good afternoon and welcome to the Health Sciences Innovation Building at the campus of University of Arizona. I'm Allison O'Toole, the Executive Director of Corporate and Community Relations here at the University of Arizona Health Sciences, representing our two medical schools here in Tucson and in Phoenix, and the colleges of Nursing, Public Health, and Pharmacy. Welcome.
And I'm Anne Marie Medina, the Director of Corporate and Community Relations for Health Sciences here at our Tucson campus. We really would have loved to have you here in person with us for our open house event, but we hope someday soon you can come here.
Yes, that's right. Of course, our goal was to host a big open house this afternoon and have all of our guests here physically with us. But yes, one day in the future, we hope to be able to have a future event where you all can come with us. But we're very excited to have you with us this afternoon to showcase our beautiful building. But this way, we get to showcase it in a way that keeps us safe and then you all at home safe as well. And of course, I just want to share that we did come in with our masks today and we just took them off as we got seated. And of course, Anne Marie brought her own hand sanitizer. So she is definitely practicing social distancing and healthy hygiene. So thank you, Anne Marie.
You know, tonight we are joined by a few of our leaders in health sciences to showcase the amazing work that's happening here. Now, we want this afternoon to be fun, and so we thought a great way to do that was to host a raffle. So you're automatically entered to win either a signed copy of Dr. Andrew Weil's True Food, which is a wonderful recipe book.
Yes.
We also have a wonderful grab bag of U of A swag donated by our wonderful Arizona Alumni Association. So we'll announce the winners of those random raffle drawings in between our speakers, so good luck to everyone who is listening in. Now, since everyone is muted, if you would like to ask a question, just type it in at the bottom of the screen in the chat box, and we'll get to those questions as our speakers are coming on.
That's right. Thank you, Anne Marie. And today we will hear from what we're calling our fantastic tour guides. But we didn't want you to miss out. At the very end of our program, we have a very special guest. The president of our university, President Robert Robbins, will be joining us live, so you don't want to miss out on that. We wanted to give you a heads up that that will be coming up. But first, to kick off our event, we'd like to turn your attention to the video. This is a welcome message from our Senior Vice President of Health Sciences, Dr. Michael Dake.
Good afternoon. I'm Mike Dake, Senior Vice President for the University of Arizona Health Sciences. Welcome, and thank you for joining us for a behind-the-scenes virtual tour of one of my favorite places on our campus, the Health Sciences Innovation Building. This building is more than a gathering place. It's an intentional integration of what health sciences stands for: education, research, and community outreach. We officially opened the doors for this new facility last fall, and many components of the space were built with you, the community member, in mind. This afternoon, you'll learn about one aspect in particular that helps to make this building so special: a world-class video art collection that helps make the humanities an important part of the healthcare education experience. You'll also have a chance to explore how we've made the building a nucleus for interprofessional education and collaborative learning, bringing together students from across the health sciences and main campuses for integrated study, healthcare training, and continuing education. And I'm excited for you to hear from Dr. Alan Hamilton, who will virtually walk you through a one-of-a-kind environment, our new Arizona Simulation Technology and Education Center. This is an exciting time for the University of Arizona Health Sciences, and I want to extend my appreciation to you for advancing and supporting our vision. I hope you enjoy this special program, and we look forward to the day when you can visit the Health Science Innovation Building in person.
Thank you, Dr. Dake, for sharing that warm welcome and for providing a kickoff to our open house this afternoon. Now, our goal for today is to really introduce you to this newest facility, the Health Sciences Innovation Building. It's a state-of-the-art instructional space. You know, it's 220,000 square feet. It sits right on the U of A Health Sciences campus, right next door to the Medical Research Building. Now, as we continue to practice social distancing this evening, Allison and I are going to be sharing responsibilities as hosts. And so we will be coming and going throughout the evening across the stage. So don't let that bother you.
Yes, safety first, that's right. It's our pleasure to introduce our very first tour guide for the evening. Angela Souza, she's the Executive Director of Planning and Facilities for Health Sciences. We are very excited to have her provide the background of how the special features of this building were designed to be a hub of innovation and to serve many purposes. So before we invite Angie to the stage, we invite you to take a look at the following virtual tour video so you can see a little bit more of the view that we are looking at.
I am Angie Souza. I am currently the Executive Director of Planning and Facilities, and we work out of the Senior Vice President for Health Sciences office. The Health Science Innovation Building was created to be the hub of our health science campus. We have the forum. It's open from the first floor all the way up to the fourth floor. It's a very impressive space when you walk in because of the volume. We wanted to create a space that we could actually use for community events. The 3 glass doors that face south in that space, they each can individually open up to create indoor-outdoor space, which then expands the capacity of that area by more than double. The way our building is oriented is that you would come into that forum, and then there is an open stairwell. You can take all the way up to the 8th floor. And the hope is you use the stairs to get up and then really only use the elevators to come down. Both the forum space as well as our 2 large classrooms that are located on the 3rd level are great spaces for large events. And additionally, we have spectacular AV, which enables different types of talks, which just provides more flexibility and opportunity to do things in our space that you can't do anywhere else on the campus. From the elevators east is what the architects referred to as the porch, and that space on floors 3 through 6 provides the student support space, which were the most requested space from our students when we were planning the building. We also have several patio areas off of that student space that they can use. The faculty advisory, as well as the 6th floor space where the D school is. Those are an example of when we say interprofessional, when we're talking about this building, we're not just talking about our 4 colleges. We're inviting faculty from all across campus. And then floors 3, 4, 5, and 6 are all variety and sizes of flexible classrooms. And then when you get to the 7th floor, that is where we have our Aztec Simulation Center. And then the floor above that is our clinical skills area. The Health Science Innovation Building was created to bring together not only our health science community of medicine, pharmacy, public health, and nursing, students, faculty, and staff, but also be a resource and a destination for our extended campus community as well as the Tucson community. I hope you enjoyed this virtual tour, and I hope that one day soon you will be able to come and visit and experience in person.
Fantastic. Well, welcome, Angie, to the stage with us this afternoon. We're thrilled to have you today as our official first tour guide. And Angie, you've worked at the University of Arizona for the last 20 plus years. So we say thank you to you for all of your dedication and service. But tell me why this project in particular is so special and unique.
Thanks, Allison. I would say that this is my favorite project that I've worked on in my 20 years, 21 in August. And one of the things that makes it unique is this is the first building that I've worked on here that people actually use the word spectacular to describe. You know, I've been involved in some research buildings, but this building it's spectacular. It's not only impressive from the outside, but when you walk in and the first impression is this huge forum space that goes up 4 levels, people are in awe.
Mhm.
One of the second things that makes this building unique is the technology. The technology that went into this building is beyond anything I've ever done, again, with all the projects that I've completed. And not only are the rooms equipped with video conferencing, which is important for our schools of nursing and pharmacy, public health, because they teach simultaneously between both our Tucson and Phoenix campus, but the whole building is interconnected. And by that I mean, if we have something really cool going on up on the sim deck in simulation, that can be projected down here into the big screens that we have here in the forum. And so you can connect all of the spaces within this building. One of the other unique points when we were putting this together is that we had input from a large group of folks. Because we were planning a facility that was going to serve all of our colleges, we wanted to make sure to include in our programming students and faculty that would teach in the building. We needed to understand what was important to them as learners and as educators. So for our students, that turned out to be, you saw in the video, the student support space. What was important to them is individual private study rooms that they could go in and shut the door. So we were able to provide 60 of those throughout floors 3 through 6. And then for our faculty, what was important for them is flexibility. And the uniqueness in this building to provide that flexibility is the fact that a majority of this space, huge expanses of space, are constructed with no columns. So we have no structural columns that impede. And so in the future, when we need to renovate to accommodate some kind of new technique, we'll be able to do that easily. And then lastly, this was also the first building where we were intentionally planning for the community. We wanted to make sure we were creating a space that we could invite community in to hold special events, galas, dinners. We have community talks. And in fact, a unique feature here in the forum is the flip up seats that have cushions. And that was actually the result of input from the Arthritis Center, who holds a series of talks throughout the year. And because of the age of the attendees of that, we wanted to make sure that we were providing a space that was going to be comfortable for them.
Fantastic. I love spectacular. I think it almost feels like we're in New York City, you know, walking into this space is so beautiful. And you touched on this a little bit, but I'd like to ask you to expand when you mentioned the faculty spaces. Can you tell us a little bit more about the faculty commons and advisory? Because that's such a unique space in this building.
Yeah, so the faculty commons and advisory is located right up the steps here. It's right on the second floor, just above the forum where we're seated right now. And that was a space that we wanted to create to bring, again, faculty together, again, not just from our health science colleges, but we're hoping folks from optical sciences, engineering, law, a place for them to get together and discuss, a place that has a variety of types of furniture and meeting spaces for them to meet. We provide also coffee and papers for them to enjoy. And then right next door, we've created, again, some meeting spaces with whiteboards, private spaces, open spaces. And this is where we're hoping to bring folks from groups like Tech Launch, Law, OGC, groups, Bio5, an area where our faculty can meet with those people. And it's kind of a one-stop shop we were trying to create so that our faculty don't have to go all over the place. We're going to bring those folks to them.
Yeah, I would consider that almost revolutionary, right? To be able to have a space like that. And speaking of revolutionary, Angie, the 6th floor of this building is dedicated to the new Health Sciences Design Program, which I love. But can you tell us more about the physical space and then the program itself?
Yes, so the design thinking is a creative problem-solving technique approach to learning. And the University of Arizona Health Sciences will advance this program in the fall. And it's going to provide courses that are going to bring minds together from all over the campus to solve problems. They can be solving healthcare problems. They can be trying to create the next tool that somebody uses for surgery. And what makes this really cool is that we're going to be bringing together faculty to teach together from all of these different colleges across the university. And this is going to be an elective that's offered to any student. So you can be a graduate, undergraduate, and you can be in any major and take this elective. So that's going to bring some unique minds together to try to solve problems. And the space is, again, I'm going to use that term, flexible. It's extremely flexible to be able to be used in a variety of ways. And we have a maker space there, which is really cool. It's going to be filled with 3D printers, sewing machines, just the things that people need to be able to be creative.
That's fantastic. It seems like perfect timing too, considering the nature of the COVID-19 pandemic, something
Actually,
like this.
yes, actually the leader, Casey Kilbaugh, who Dr. Dake recruited from the School of Engineering, has actually been using design thinking through this COVID process to actually help to create some PPE. So using design thinking.
She's already got to work. That's no surprise there. Well, wonderful. Well, thank you so much, Angie. And, before we transition into our next speaker, we wanted to take a look at the next video, which will actually allow us to dive in to learn a little bit more about the design thinking program. So thank you so much to Angie, and now we'll turn your attention to the next video.
What is design thinking? Once upon a time, an industrial designer named Doug Dietz stood beaming with pride as he visited a hospital to admire his brand new, high-tech MRI machine. But when the first patient, a little girl, saw the machine, she burst into tears. She didn't see a shiny new machine that could help her. She saw a terrifying monster. And she knew she'd have to go inside it and be very still, which for a very frightened little girl would be very hard to do without taking medicine to make her sleepy. Doug knew his technology would be great at diagnosing a lot of bad things inside people that needed to be fixed, but he now realized the little girl's experience would not be great at all. To her, his creation was loud and scary. He needed to figure out how he could help her and to make her fear go away. So he brought together a team of experts, educators, pediatricians, and designers to study how MRI machines trigger anxiety in young patients. They watched children play and noticed them use their imaginations to transform everyday objects into extraordinary things. They wondered, in the hospital, instead of a fearful experience, could children imagine they were on a wonderful adventure? After a lot of brainstorming, the team worked together to reveal a newly designed MRI at a children's hospital, one that turned the MRI procedure into a grand space adventure. Now, the loud noises are the spaceship going into hyperdrive, and the headsets they wear help them communicate with ground control while on their space voyage. Instead of undergoing a medical procedure, they are on an exciting mission to outer space. The number of children needing sedation has plummeted, and more scans can be completed each day. After hearing a patient ask her mum when she could come back for her next MRI, Doug knew his human-centered design had made his corner of the world a much better place. And for thousands of children who have needed an MRI scan over the years since then, they lived happily ever after.
Well, welcome back, Anne-Marie. I love that video. I
do
think
too.
it plays on being a parent and the stress, and so it's exciting to think about what could happen here in the future.
Amazing.
Well, as Angie mentioned, we have a fantastic opportunity to learn more about the Health Sciences Innovation Building as a component to clinical training.
Yes, and you know, when you think about clinical training, I know that we all think about Dr. Alan Hamilton, who is our Executive Director of the Arizona Simulation Technology and Education Center, or as we call it, ASTEC. And that is on the 7th floor of the Health Sciences Innovation Building right here. Dr. Hamilton is a graduate of Harvard Medical School. He is Regents Professor of Surgery. He is a tenured professor in neurosurgery and also has professorships in radiation oncology, psychology, and in electrical and computer engineering. Dr. Hamilton also served as a senior medical script consultant on Grey's Anatomy for more than 15 years. We'd like to welcome Dr. Hamilton to our event and have him share with us why Aztec Center is important for our students and for our community. Welcome, Dr. Hamilton.
Thank you. Thank you, Anne Marie. Thank you, Allison. It's hard to believe how far medicine has come. I only wish when I went to medical school, something like Aztec existed as a fun place to learn, but to also ask questions and to train and to advance healthcare. We built this space obviously originally with the idea of improving the quality of healthcare and by giving our students across the healthcare spectrum the opportunity to train and to practice and to refine what they did without ever having to worry about imposing that on our patient population. But there's another aspect about the building that was very important. That was bringing together our teams so that they started from the very beginning of their careers training together. And then that was important not only because of health and fostering collaboration, but it also served as a major research hub for new technology, for new techniques, for new procedures. And finally, we also wanted this building, the entire sim deck, which is a one-of-a-kind facility, it's the first of its kind in the country, is transparent. And so we invite the public when the building is back open to come and walk around. And we literally wanted for healthcare to be transparent to the community so that patients, their families, our children, our school children could see the efforts that we're going to try and make healthcare better. And never was that more important than right now. So it was meant to be a community asset as well. And we're very fortunate that not only do we train all of our students and residents and fellows, but we also train our first responders, and we also have 14 different programs for middle school and high school participation as well. So this truly is, as Angie said before, a building that's open to the community.
That's fantastic, Dr. Hamilton. I think you set this up perfectly. Why don't we go ahead and dive into behind the scenes and take a look at the video together?
Okay. I'm Alan Hamilton. I'm a Regents Professor of Surgery. I have 4 professorships, and I'm the Executive Director of the Arizona Simulation Technology and Education Center at the University of Arizona. Aztec's role was recently expanded so that it took over the simulation training mission for all of the health sciences, which was radical because it's something that hadn't been done. So it's a very, very broad mission, and there's really almost no center in the country that has a mission that gigantic. Aztec was built in large part to be incredibly flexible so that we could change the configuration. And that was really because we had no way of knowing what was going to happen in simulation in the next 15 to 20 years, let alone COVID. It is supposed to be able to accommodate any kind of training, everything from how do you do a procedure to how do you take care of the patient. So it's meant to be essentially an extension of whatever environment the student needs to be immersed in order to learn how to do their job to the very best of their ability. It's an important space because it's really made a statement about the future that we really believe we could use high tech to connect ourselves to any place or any space, and that ended up being very true. Aztec was built
like a gigantic fish tank. We want to be very transparent about everything that we're doing to make medicine better. So this is really the building for the future where anybody can come from any aspect, whether it be psychological, whether it be engineering, whether it be financial, whatever it is, they can come and use this as a laboratory in which they can test out their theories, and then they can turn around and make people's lives better.
Dr. Hamilton, there are amazing things that are happening within Aztec, but I was also very interested to learn about how your center supports community needs that are far beyond the physical space that we have here at HSIB. Can you tell us a little bit more about that?
Well, as I explained, we really wanted outreach to be one of the main themes of the HSIB and Aztec. So one of the things that's been a crisis across America has been the opioid crisis. And many of the people who interact with addicts, very often it might be in a homeless shelter, it might be on the street, it could be a clinic. They may not always be doctors or nurses who have training, but we know that being able to treat an overdose very quickly with Narcan is very important. And we've now made Narcan available so that you can literally take it with a snort up the nostril that you push with a little pump. So we needed to train lay people, not medical people, but regular lay people, even families, parents, how to use this. And so we created a program that was designed for lay people to come in and simulate the situations that they might find and really make them at ease about using this. But we do the same thing now, for example, with our first responders. As the needs change, as they have with the COVID crisis, we've had to create remote facilities so that we can help train our first responders and our pulmonary teams in the hospital as well. So it's a mission that's constantly responding to what's going on in the world around us. And that's really the way healthcare has to be.
Thank you, Dr. Hamilton. Yes, that's a great segue to my next question. I thought it might be helpful to our audience. Maybe you could walk them through a little bit about how you set up a scenario, maybe a pandemic scenario in the Aztec Center. And then what is the value and benefit that the students receive from going through those types of scenarios?
So these are very large interprofessional education exercises. Often we might have 450 participants across the entire state. What we do is we create a computer model, and we hijacked a zombie game and we made it into a pandemic so we could change the rate of spread and how it spread. And then what we do is we run the game, we stop it, we ask all of our students across the state to break up into small groups. They also have a panel of about 20 world experts that they can ask lawyers, they can ask fire support, EMTs, they can ask a former Surgeon General about federal support from FEMA and so on. So they can ask experts as they try and work through these problems. And many interesting things came out of the pandemic exercise. It actually very successfully, our students very successfully predicted problems in prison, problems in nursing homes. They predicted problems with borders, air traffic, the economy, problems with our First Nations. And one of the things that over and over came back to me was that the students constantly were reinforcing how important trust was, how important it was to have community leaders and scientists whom they could trust in order to propel the communities forward to get through the pandemic. And interestingly enough, it was the students who created an international consortium of G20 to create 50 factories worldwide to create vaccine, which was the end event that actually ended the pandemic. So let's hope that our students' predictions come true.
Thank you, Dr. Hamilton. I agree. I think that the students are probably the solution to our problem, and we should be listening more. Thank you so much. We're so fortunate to have you leading and teaching here at the U of A. Next in our program, we are thrilled to welcome Julia White, the Assistant Director of Engagement and Events for UA Arizona Health Sciences.
Yes, thank you so much, Dr. Hamilton. Julia will be highlighting our El Mirador project and the integration between art and humanities in our building. But before we welcome Julia to the stage, we invite you to watch the following video featuring the El Mirador project.
Art can inspire, influence, heal. As one of the country's leading academic medical centers, the University of Arizona Health Sciences is addressing the global health challenges of the 21st century, including how to educate and train students to build and lead the future of healthcare. Welcome to El Mirador Project. Whether in medicine, nursing, pharmacy, or public health, students benefit when exposed to the transformative power of art in health and healing, breathing life into hearts and minds, fostering healthcare professionals to think beyond the classroom and the disease. El Mirador Project helps create a learning environment that encourages critical thinking and empathetic and intuitive skills to form meaningful connections with patients. This public arts program is visionary. Its fusion of art and science is growing, and you can be a part of it. Visit, experience, support, and help transform the next generation of healthcare professionals.
Welcome, Julia. As the special events manager for this building, what's been the reaction of the people who come here, especially for community events, to the El Mirador Project?
Absolutely. Thank you, first of all, for having me. The El Mirador Project has been well received by our community. This has been a project of Dr. Dakes, and he is a huge advocate and supporter of the arts. And to be able to encompass our building, this beautiful contemporary building with digital art throughout the space. It's played as a backdrop for many of our events. So we see a lot of our community members that want to use the space because of the look and the feel and the flexibility, but then when they enter our space and they're greeted by a Bill Viola piece or the Jennifer Steinkamp piece is playing above, it really adds to that extra flair and that extra oomph of why this building is so special.
Can you tell us a little bit more about maybe one of your favorite ones? What is one of your favorite projects that we have going on here?
For the El Mirador, it's so hard to tell. I personally love the Bill Viola piece. When you walk in every morning, you are greeted by the woman that's floating up in the water, and then throughout the day, you hear her splashing. So just as a slight reminder that there is somebody else or something else in this building that allows you to have that relaxation or really allows you to be more integrated into that art. And we're seeing that the humanities and arts play a huge part in health sciences, and we're seeing all of our colleges really embrace the humanities in general.
It makes such a big difference in this environment. I know that when I leave in the evening, I always stop and I look at the trees waving in the wind, and it just sets the tone for my drive home. So it really does make for a wonderful impact.
It really does. And the collection has started years ago. It was started by Dr. Dake, and then we are always looking for more advisory members to join the team to help with the curation, but also to really be involved in the programming. We have multiple things that are coming down the pipeline where I want to create a digital tour of our pieces. We're working with UA Presents on some live performances within HSIB so that the pieces are behind their performances as well. So really want the community to understand that this building is for them, whether through an event or just to come and explore the art collection on their own.
So on that note, can you maybe share with the audience how they can even if they're university or community members, how they can get involved and use this facility?
Yes, absolutely. So this space is available for all. We do see classes held Monday through Friday, or we will once we get back into the regular scheduled program. But we've had partners throughout the community that have used this space, as Angie mentioned, as galas. We've had lectures, we've had art talks. If anyone's interested interested in reserving the space and making it their own, the space is very flexible, so we can have it designed any way that you see fit. But you're welcome to email me, and Angie will, and Anne-Marie, you'll send out my information.
Absolutely. And thank you so much for joining us today and for all that you do to engage our community. And we're going to be sending out that virtual events calendar along with all the other information in our follow-up email. So make sure you look for that link. And also the videos for El Mirador are posted on our website. So make sure you click on that if you'd like to see it again. And also, we hope that someday soon you can come into the building and actually see the virtual art in, the digital art in person. So thank you again, Julia. We really appreciate it. So we're going to switch here, and Allison's going to come back.
Yes.
She's got our U of A cup with some raffle prizes in it.
We are very excited. It's come to the time in our program where we're going to go ahead and do our raffles.
Wonderful.
So I'm going to slide this over to you.
Okay. I'm very happy to pick out a name and see who wins. So our first prize is our signed copy of True Food from Dr. Andrew Weil. I can tell you I did sneak a peek, and there are some fantastic recipes in there and some wonderful information to help you eat healthier and lead a healthier life. So our winner is Susan Silvertooth. So congratulations, Susan.
Congratulations to Susan. And Anne-Marie will be sending you a note to make sure that you get your book.
I will
so
get
don't
that
worry.
to you either in person or through mail, however works best.
Yes.
And so our grab bag here we have from the Arizona Alumni Association, and it's got some wonderful U of A gear in there. And our winner is Idarn Ikpu. I'm glad somebody spelled that out for me so that I could read that correctly. So congratulations to all of our winners, and we will make sure and get those to you as soon as we can. So I will be in touch.
Yes, that sounds great. Well, since we just have a quick moment before President Robbins joins us, Anne-Marie, I thought we could take a little bit of a dive into Wellness Wednesdays, since you are leading that, co-leading that with Caroline Berger, our other Director of Corporate and Community Relations. So what do you think has been the best benefit of Wellness Wednesdays?
Wellness Wednesdays has been wonderful in that it's bringing collaboration across the university. We have wonderful faculty and staff from all different colleges across the university. They're doing presentations on all different types of topics. Everything from getting a better night's sleep to how do you increase the good gut biome so that you can be healthier and be better at having an immune system that can fight off any of the bugs that are out there currently. We also have wonderful presentations on gardening and cooking, how to build your relationships or keep those relationships stable while we're going through this wonderful isolation or spending a lot of time together. And so they've been really great. And it's also been wonderful to see the community come together and have people from our community actually participate and get to experience the wonderful faculty that we have here at the university and the wealth of information and talent that we've got. We've had people join us from as far away as New Zealand and Saudi Arabia, and even I think we had someone from France and Spain. So people have been joining Wellness Wednesdays from across the world.
That's so exciting. That's really exciting. Well, Wellness Wednesdays, you too can join us every Wednesday at noon. Mountain Standard Time. We have 30-minute sessions. Come in, we invite you to engage with our speaker, learn something new, and as Anne-Marie said, we're supposed to increase health and decrease stress. So that is the point. So we'll definitely send that out. And you mentioned the virtual events calendar. I look on there about, we've got about 20 events a week, it seems like. So a variety. And one thing we didn't even get a chance to talk to Dr. Hamilton about is that he's been hosting these sessions talking about COVID-19 specifically for kids.
Yes, those are wonderful sessions for children. It really helps bring the knowledge level to where they're at so that they can understand what's going on and helps them to know how they can deal with the situation as it is. Yeah.
Right, absolutely. Well, thank you so much for providing that little tidbit and update for our guests. And Barry, since Barry's in the control room, and by the way, thank you so much to the whole team that has been feverishly, literally running around behind us, making sure that everything was in place for our event tonight. Why don't we go ahead and show our Tomorrow is Here commercial, which is a great way to have an opportunity to learn what health sciences is and our vision of tomorrow is here. So why don't we go ahead and play that, Barry, and then we'll be right back to see if Dr. Robbins will be able to join us. Thank you.
Everyone thinks about tomorrow, but some of us live in a place that asks more, a place that pushes us to go further, that inspires us to keep searching for what lies ahead. So while others talk of a coming transformation, a new era, we know the future is already here. It's in our community, which is growing and diversifying. It's in our people who don't want to just live longer lives, but better ones. It drives our researchers who are transforming the human landscape. And it inspires our graduates who are emerging ready to build and lead a world of constant change. At the University of Arizona Health Sciences, we don't see tomorrow as something over the horizon. Tomorrow is here.
Well, every time I watch that, I feel like I get goosebumps.
Yes,
Just, it helps
I love that commercial.
It's kind of like our true north to reset where we're going and what we're doing. And I think nothing has been more truer than watching the last 4 months, our faculty, students, and staff coming together, pivoting their work to figure out how we can be a resource, obviously, to COVID-19. So. Well, ladies and gentlemen, we apologize. We have not been able to make a connection with our University of Arizona president, President Robbins, so we do apologize, but we want to thank you all for joining us this afternoon. It's been a real pleasure for us to show off this extraordinary space. We hope that you've learned something new. We ask that you continue to engage with Anne-Marie and I, follow us on social media, continue to learn more about the great work that we're doing here at University of Arizona Health Sciences.
Yes, and on behalf of all of us at the University of Arizona Health Sciences, we thank you for joining us today. We really hope to see you in person soon. And always remember, bear down and mask up.
Mask up.
Take care.
Have a great afternoon. Thank you for
Bye.
joining us.